Hey everyone out there. Thank you for choosing Stark Associates Insurance Agency to view this seminar about enrollment into Medicare. This is a great first step for you to start having an understanding of exactly how Medicare works, what the different parts of Medicare are, what the different letters mean, and also how you enroll from a timeline standpoint to set you up for success for your birthday month, which will be on your 65th birthday month, your effective date onto Medicare. So I put together a few slides here to make it easy and more palatable because of what we found is folks are literally drinking out of a fire hose. They have no idea where to start. They talk to their friends. There's rumors. They've heard of things. Marketing pieces come in the mail. They listen to the radio. It's on any type of social media. It's following you around and you're confused on what to do. Here we're going to have steps laid out for you so you have an understanding and you can lower the anxiety. So let's get into it. So it is important to know that this seminar, we're going to go over the steps to enroll in Medicare. And there are actually 4 steps to success. And this Medicare card here is what you're going to end up with after you communicate to the Social Security Administration to enroll in Medicare. Okay, and it's important that you know that the Social Security Administration doesn't just sign you up to go on claim to collect your paycheck. At 65, you have the opportunity and should enroll in Medicare. So Social Security Administration runs Medicare. So this is the 2023 edition, and we're going to get into the different parts of Medicare. But first, what I want to do is I just want to congratulate you because you have earned this benefit. This benefit you've been paying into since you started working. And let's clear the air. There is nothing free. There's no free lunch. If something's free, it's too good to be true, as your parents probably told you. And it rings true through Medicare. Now, you are going to get a benefit, Medicare Part A, which is free. But you've essentially worked your entire life, and it could have been over $100,000 that you've paid into the system through tax withholding to get your benefit. But just know that you're coming from a plan that probably has an employer plan that has higher deductibles, co-pays, a maximum out of pocket, a network that you're going to have to search, and you've had searched for years and years to see if your doctors participate, which could increase the anxiety because what good is an insurance that doesn't cover the doctors that you want to see, right? So what's the timeline for enrollment? So what you're going to be entering as you age into Medicare at 65 is the initial enrollment period window. And you have a 7-month window to join. 3 months before your birthday month, you turn 65, through your birthday month, and 3 months after you turn 65. A 7-month window. It's a pretty long window. So you think, right, that you're going to be able to hit that mark. And surprisingly, sometimes people miss it and they forget to enroll in Medicare, which could lead to possible late enrollment penalties. But what are you going to do? What's this initial enrollment period entail? Well, you're going to communicate to the Social Security Administration and you're going to let them know that you want to enroll into Medicare Part A and Medicare Part B. Medicare Part A is hospitalization coverage. Medicare Part B is doctors and outpatient. And make sure that you start the process at least 3 months ahead of time. Now, we help our beneficiaries with this process. We are not the government, okay? But we can help assist you to gain the knowledge for the questions for you to ask the counselors at the Social Security Administration when you go ahead and enroll. But planning is imperative, and you want to make sure that you're communicating to them 3 months before your birthday month. And you can do it a couple of different ways. You can set up an appointment with somebody in the Social Security office to go in and see them. You can set up a phone appointment, which they'll have you call back. They'll set an appointment 30 days after that first call, so maybe not the best way. But the third is just going online to ssa.gov and scrolling down to Medicare drop-down box in that website and clicking on Medicare. If you do that, you're going to enroll into Medicare Part A and B only, assuming that you aren't taking your Social Security benefit at 65. If you're listening to this now and you're turning 65 in the next, let's say, 6 to 12 months, your full retirement benefit isn't at 65. And it's up to you what you decide when you want to take your Social Security, whether early or not. But most of you that are listening to this probably plan on going a couple of more years before their full retirement age, whether it's 66.6 or 67, depending upon your date of birth. But you're going to want to enroll in Medicare Part A and B only. And you can do this on the ssa.gov website easily, and it only takes about 10 to 15 minutes. There's a confirmation that comes to your email address, and then the government says in about 2 to 3 weeks you'll be in receipt of your red, white, and blue Medicare card, we hope. Generally, I've seen about 4 to 5 weeks. So that starts the process of getting your red, white, and blue Medicare card, and Medicare is going to be your primary insurance moving past your 65th birthday. So what are the parts of Medicare? So there's 4 parts to Medicare: Part A, Part B, Part C, and also, last but definitely not least, Medicare Part D. And we're going to go over these options, okay? So Medicare Part A, and I wanted to give you this visual of the hospital here, is your hospital insurance. It's Part A. It's anything in the hospital is covered. You must remember that Medicare will be the first to pay and does not pay everything. So you're going to need some type of private Medicare supplement policy to make yourself whole. And we're going to talk about this towards the end of the slideshow here and the seminar. So Part A is hospitalization. Anytime you get admitted to the hospital, Medicare Part A will pay. Generally, for most of you, as long as you have had 40 working quarters or a minimum of 10 years that you've worked and paid into the system, some of you might laugh now because it's a drop in the bucket, of course, Medicare Part A is free. But just know you've paid into this benefit probably over $80,000 over your working life. So it's not really free. There's a cost to it. So that is Medicare Part A. And what I'm going to do is I'm just going to go over the coverages for Part A. And you probably, depending if you get a secondary or an advantage plan, depending where you are, you may not see any of these charges, but I just wanted to make you aware of what the Part A deductible and coinsurance amounts are. In 2022, it was $1,556 was the inpatient deductible. It's going up to $1,600. And you can see the daily coinsurance, which is sharing the cost, is $389, and it's going up to $400. And then they have what's called daily coinsurance for lifetime reserve days. Most of you won't get there, and any skilled nursing facility coinsurance. Again, most of you won't see this, and the reason why you're not going to see this is because you're going to have some type of secondary coverage that will literally pay for anything that Medicare Part A doesn't cover, which means if you go into the hospital, something happens, you have an operation, a procedure in the hospital, and you have this secondary coverage in conjunction with Medicare, which is primary, you probably will not pay anything. Pretty easy to understand, right? Your cost will be $0. So that's Medicare Part A. Medicare Part B, and this is where you're going to be spending most of your time, is doctors and outpatient. Okay? Anytime that you go to a doctor, outpatient procedure, have an x-ray, blood work, or routine preventative is covered under Medicare Part B at 80%, 80, and it's important for you to hold on to that. Medicare does not pay for all of your coverage. Again, enter secondary or Medigap policy. That's a policy that will protect you for that 20%, and we'll get into that later in the slideshow. Okay, but this is where you're going to be spending most of your time. You're not going to be in the hospital, and most of anything that gets done is pushed outside the hospital and outpatient, MRIs and x-rays, and we've mentioned it up here. It does have a deductible, Medicare Part B, and I just wanted to show you, I'm going to get out of the way here, the Medicare Part B deductible over time since 1975 was $60. It went up in 2022 to $233. Again, some of you may look at this and be like, $233, that's the Medicare Part B deductible. And the definition of a deductible is paying first before insurance will pay, meaning the consumer, the Medicare beneficiary, will have to pay first before Medicare will pay. So the first $233 of 2022 would have to be satisfied by the Medicare beneficiary, and then any cost after that will be covered at 100% by Medicare and the Medicare supplement. So some of you might be thinking, man, well, I have copays in my plan, or I have a $1,500 or $2,000 or $5,000 deductible in my plan. Wow, this is pretty good. Not only that, but I just want to let you know that Medicare coupled with a Medicare supplement policy, there are no copays, no maximum out of pockets, no prior authorizations, no pre-approvals. You go anywhere across the country you would like to go to see a doctor. There are no networks. There is no participation where you have to worry any issues. What happens is most doctors take Medicare and all hospitals take Medicare. So your days of thumbing through that old provider directory that wasn't accurate, or now most recently, of course, going on the private provider directory online, is a thing of the past. I just wanted to focus in on that. So now, the deductible for 2023 actually, and good news, is going down to $226. So assuming when you go on to Medicare, the first doctor's visit that you have, what's going to happen is you're going to be responsible for the first $226 to pay the doctor. And that's important to note, but anything after that will be paid at 100% by Medicare and the Medicare supplement policy, if that's the plan that you so choose. Okay. Now, I just want to let you know, Medicare Part B, no matter how many working quarters, actually does have a premium associated with it. And here are the costs. If you are a single and you're making $97,000 or less, and you go, wait a minute, 2021 return, that's right. When you put in your application for Medicare Part A and B, they're going to look back at your income 2 years prior to see if you're deemed a higher earner. Higher earner is income-related monthly adjustment amount, or IRMA, and they look 2 years back to true it up. This is the base premium for Part B in 2023, okay, and that's per individual. If you make more, between $97,000 to $123,000, they're going to increase your premium accordingly all the way up. And here is the joint file return for Medicare Part B for those of you that are filing taxes married. And MAGI is modified adjusted gross income. So that's Medicare Part B, and you could see as it goes up over time depending upon your income in 2021. Now, if for whatever reason that you disagree with this, you have the opportunity to appeal, and that IRMA letter that comes into your household that says, sorry, Mr. and Mrs. Jones, you made $246,000 in 2021. You are going to pay each, assuming both of you are turning 65, $329.70 to us, to Medicare. If you disagree with that ruling and you could prove that you made less in 2021 or you're retiring in 2023, then they may consider it and lower it. Also, Part D will increase as well. This is assuming that your drug plan is $33. If you, again, are a higher earner, they will increase your premium accordingly. Now, the biggest question is, well, I'm not signing up for Social Security, and generally your Medicare Part B premium will be withheld from your Social Security check. But for a lot of you, you're not going to be on claim for Social Security. So there are a couple of ways that you can set up an account to pay for your Medicare Part B premium to the government, because you do not want to be late and you do not want them to cancel your Medicare Part B premium. They give you many opportunities to pay, and the first is quarterly. They will send you an invoice in the mail, and you can pay your Medicare Part B quarterly. You could set it to bill pay or however you like, and that's more of the manual way of waiting to pay it. That might not be the most effective way. Most effective way will be setting up an account in mymedicare.gov. It's mymedicare.gov. You could set up in there your banking and routing account information, and the premiums will simply get deducted every month out of your bank account until, of course, you decide to go on claim for Social Security, and then they will eventually deduct it, kind of like your paycheck when you had medical insurance through your employer. They will deduct it through your Social Security at whatever time that you get on to Social Security, whether it's your full retirement age or you wait even later. And then it will stop coming out of your bank account. And that's how the government will collect those premiums. And the good news is, let me go back to this. This year it's $164.90. Last year it was $170.10 was the Medicare Part B premium. So it went down, right? Awesome. That's great. We're excited for that. Look, it hasn't happened in 10 years. So jokingly, we enjoy seeing decreases in the world of insurance where everything generally goes up, but we're happy to see that it has gone down, in fact. Okay, so that is Medicare Part B. Medicare Part C is called Medicare Advantage plans. Medicare Advantage plans are going to be heavily marketed to you in the mail. Your phone is never going to stop ringing. At some point, you shared your information. Everybody has your birthday. Everybody is going to reach out to you and say, hey, pick me, pick me. This is the insurance that you should pick because we said so. Now, generally, our findings is that historically, if you've been a utilizer of insurance and you've had it through your employer, you're given a plastic card, you put it in your pocket, you don't know what insurance carrier you have, you don't know how the benefits work. But then magically, when you turn 65, you're all of a sudden going to know everything that you need to know about insurance and pick the right plan for you. And some of the way that these things marketed to you are keep the same plan you have or keep to the closest benefits you have. Just know you get what you pay for, and there is so much marketing mail in the Medicare Advantage space. I would advise you to lean on an independent insurance broker, an advisor that specializes in Medicare planning and Medicare plans to lead you down the path of what's best for you. All the marketing materials say what's best for them, not you. They're not taking into consideration. They don't know anything about you. So make sure you line yourself up with somebody that asks questions to learn about your certain situation, budgeting, and cash flow to see what plan is going to be best for you. And a marketing piece is just a generalization slapped in your mailbox. Hey, here's this Medicare Advantage plan. Pick me because we have all these great fringe benefits and we can dazzle you with this stuff. You can see how much I love Medicare Advantage. So Medicare Advantage plans, they do offer you a few things, and we're going to go over them here. So this is Part C. So your Medicare Advantage plan includes a network, co-pays, deductibles. You have to satisfy your maximum out-of-pocket or MOOP. It does have an integrated drug plan, okay? And what this means is these plans, generally, you will voluntarily leave original Medicare and go to a Medicare Advantage plan, which is run by a private insurance carrier. Now, these carriers might be the same carriers that you've been on before you were 65, but that doesn't necessarily mean it's a good choice for you, okay? They do offer fringe benefits. They have telehealth. Some carriers will offer home safety modifications to make your home more safe for free, in-home supportive services, coverage for over-the-counter drugs, emergency response devices, and a litany of other things. Fitness memberships generally dangle in front of these marketing pieces as well. What I will tell you, though, is that you are going to have to go through pre-approvals and prior authorizations if you voluntarily elect to enroll into these Medicare Advantage plans. You're going to be inside a network versus original Medicare, which has no network. Okay, so the network that you might be in with these Advantage plans might be limited to a few counties in which you live. And some of the issues with the plans are if you're referred to from a specialist to another specialist that doesn't take the plan, you're going to have to either find another specialist or change your Medicare Advantage plan year over year. And I will just tell you, be aware, there are going to be plans that are offered to you for $0. But generally what happens is the insurance carriers will get paid by Medicare $1,000 or $2,000 a month, depending upon where you live. What happens is they keep that money and then they dictate the care to see if it's medically necessary for you. It may be a fit for some folks to enroll in the Medicare Advantage plan because of budget necessarily, but I just want you to keep your eyes open that Advantage plans may not be the best option for you. And this is Medicare Part C. Let me move out of the way so we can introduce the next part of Medicare. And last but not most certainly least is your Medicare Part D. It covers your maintenance medications and it's stand alone. So some questions that you would ask enrolling into Part D are, and this is, by the way, the third step out of 4, lining you up for success of understanding for Medicare, is what medications are you currently on, right? We would ask you what medications are you currently on, what's your dosage and frequency, and what pharmacy do you go to? This is all going to affect your cost of maintenance meds. And how many carriers can you choose from to enroll in your standalone drug plan? Let me go down to the bottom here. So I'm going to show you just what we go through with our Medicare beneficiaries, kind of the magic behind the curtain, if you bear with me, on how we look up a Medicare beneficiary's drug plan, how we search by their zip code, and then the ultimate recommendation that we give for their standalone drug plan. Hello, everyone. This is the magic that is Medicare Part D. A lot of common misnomers are, I have a Medicare Part D plan, but I don't have a private insurance plan, or I don't have a private insurance plan, but I have Part D. Just to clarify, Medicare Part D is the umbrella, and underneath it are about 26 insurance carriers that vie for you to pick them, but it all depends upon your maintenance medications. And this is where we search every year for you to make a determination on what carrier is going to be competitive. We go to Medicare.gov. Anybody can do this. Your pharmacist can do this. You can do this. Most don't want to do this because they just don't want to be hassled with it, and they leave it up to us because we search hundreds of maintenance medications every year and make recommendations based upon our search. And I'm going to get into it so you have a little bit of an idea of exactly what it looks like, okay? So we go to Medicare.gov here, and what we want to do is we want to find health and drug plans. So we find plans now, and it's going to ask me what zip code, so I'll just do mine. And then select plan type, drug plan Part B. We're going to apply, start, and then it says, do you get help with your costs from one of these programs? Generally, you don't get any help, so we would do next. And it's actually saved the search that I've had before, amlodipine, blood pressure medicine, losartan, blood pressure, and I just to jack the prices up a little bit. These are very common, and many people are on blood pressure medicine or cholesterol medicine that are very inexpensive. Okay, but if you have an injectable, something that you need to inject, that could be more expensive. Amavig here is an injectable to help with migraines. So I search these in the quantities in the zip code. I'm going to say done. I'm done adding drugs. Okay, so I'm going to search the pharmacy in the area within the last 5 miles. Okay, so pharmacies charge differently, and a lot of people don't realize that. They think whatever pharmacy they go to, we have the best deal. Not necessarily true, to the point where pharmacies could share a parking lot and still charge differently. So it's important. Some people say that I am only going to one pharmacy and that's it. I'm not going to any other pharmacy. Okay, fine. But generally what we do is we will search 1 or 2 different pharmacies to see if there's any cost savings. Because ultimately, why would you want to pay more for a maintenance medication than you have to, right? You don't want to, and that's our job here. So in the area, we're going to look at Walgreens. We're going to look at Genoa Healthcare. And then let's look at Rite Aid. Okay, so we're going to do 3. Done. Okay, so it's loading. Now, lowest drug plus premium cost. That's how we search based upon recommendations, and this could change every year. In this year, the Cigna Saver RX PDP comes up for this search as being the most competitive. Last year, they were not the most competitive. They were in the middle of the pack, and there were other carriers that were more competitive. But in this situation, you could see that they come up as most competitive. Monthly premium, $13.80. And again, this is for your Part D drug coverage. And I just want to tell you, it has everything to do with your maintenance medications, not the drug plan. We search for your maintenance medications and then the drug plan comes out. It surfaces, not the other way around. A lot of misnomers are somebody tells you, oh, check this carrier out there. They're great to deal with. It has nothing to do with that. It's about your maintenance medications. And unless that person is on the same maintenance medications and drug plan that you are, drugs, then it's not going to make much sense for you to be on that plan. You have to be on the identical same maintenance medications. A lot of people are on different meds. They'll be on different drug plans. Even with the same family, you might have 2 Medicare beneficiaries on different drug plans. That's normal. You might not be taking the same maintenance medication drugs. Let's get back to it. So you can see here the yearly drug and premium cost is $2,091, and the deductible that will have to be met first is $505. The next best plan, and you can focus here on the out-of-pocket, $2,091. $2,196 is the Cigna Secure. Then WellCare pops up, $2,221. You see what's happening here? It's getting more expensive. So depending upon the plan and how it pays, you generally want to look at the least expensive plan. Now, well, that gives me the annual drug and premium cost. Can I look at the plan details? Sure you can. So we have an overview that we provide. Again, $13.80 is the premium. The drug deductible is $505 in this situation. And what that means is that you will have to pay first before the insurance carrier kicks in, and that's up to $505. And this number keeps going up, and it probably won't stop. Now, pharmacies, Rite Aid Pharmacy, preferred in network. Walgreens, preferred in network. Now, this Genoa Healthcare is just in network. It's not preferred. So what that means is they may not have the best rates for this plan that's offered. So you can see here, look at the injectable, $1,900, $1,900, $1,840, which is so interesting because they say it may not have the best rates, but this is less expensive. But look when you get to amlodipine, $41.65 to fill versus $3.66 at Rite Aid. I mean, who's looking at this stuff, right? So your total yearly drug cost if you go to Rite Aid would be $1,926. Walgreens would be $1,926, and you're going to pay $2,002 if you go to this in-network pharmacy, although it's not preferred. So it gives you an estimated drug and premium cost. It tells you what you're going to pay at each pharmacy, when you'll meet your deductible. In this case, because I put the injectable there, you're going to meet your deductible immediately because the injectable is the most expensive cost here. Let's go down and show you. So in January, you're going to hit your deductible of $505, right? So you're going to have a little left over. You're going to have to pay $545. And then it predicts February, March, April, and May, assuming you're going to Rite Aid, you're going to pay $40. And then in June, it bumps up a little bit, and then, it jumps up pretty high. Well, you're going to probably hit the coverage gap at this point, and that's where you're going to come out of pocket a little bit more. I go into detail about this in the seminar that we provide on how the different coverages are and how they get paid for within the Part D drug plan. And this could be a big issue for folks because they get used to paying a certain amount. Then all of a sudden it changes wildly. Nobody can necessarily tell them why. And generally it's because they've hit the coverage gap. So it gives you the estimated drug costs and coverage phases. Also, it gives you star ratings here on the drug plan, and it's based upon a couple of categories. It's on customer service, member complaints, experience with the drug plan. So generally what happens is if it's close and we have two different carriers, we will look at the star ratings to see what the customer service experience is, and we'll dictate what plan that we think, based upon our experience, the Medicare beneficiary would go into. But this gives you a fantastic overview of the cost of your maintenance medications. Now know that it is going to change every year. Your maintenance medication should be reviewed every year during the annual election period, which is October 15th to December 7th. I'm actually doing this at the end of December right now in 2022, looking ahead to 2023. And you can see here the retail pharmacy 2023 estimated drug costs. We send out emails and communicate to all our beneficiaries in the beginning of October to say, hey, send us your maintenance meds. We want to review them because the plan that you're currently on, let's say it was this one, might not be the most competitive plan moving forward for 2024. And again, we will review that. And don't get too comfortable with your drug plan. It's a dating situation, basically, as I've said over and over again. What happens is you look to change because it's only going to be in your best interest when you're looking to change your drug plan. And we're here to help you. So here's the magic behind the curtain. And I just wanted to give you a couple of different drugs so you can have an idea of what the cost would be, and that they're not all generic. Some are a little bit more expensive, but you are going to have to pay at the pharmacy. And this is a great tool that you can see what you would be paying approximately. Thanks again. So that was what we did. That's the magic that's behind the drug plan. And we do it every year, like I said in that video, with our Medicare beneficiaries. And that's something that's very important for your standalone drug plan. Okay, so now we're going to move on to Medicare supplement or Medigap. What is that? What's Medigap, and what are those letters? It's confusing. I'm getting the parts confused with the plans, and the plans confused with the parts. So you have, and we have reviewed up to this point, Medicare Part A, which is hospitalization, Medicare Part B, which is outpatient and doctors, Medicare Part C, which is Medicare Advantage plans, and Medicare Part D, last but not least, which is drug plans. Okay, so now what happens? So now what you do is you need to bridge the gap. You need to look, and I put here, watch the gap. You need to look into a Medicare supplement policy that will pay for what Medicare Part A doesn't pay in the hospital and what Medicare Part B doesn't pay at outpatient and doctors. The 20%, if you will. So you want to watch the gap, and I put an arrow to bridge the gap here, because you might say, well, what happens if I just go without a Medicare supplement policy and just have Medicare Part A and B? Well, as I illustrated earlier in this, you will have to pay a pretty hefty Part A deductible if you get admitted into the hospital. If you have a Medicare supplement plan, it will pay the difference and you'll pay nothing. Medicare Part B, you would pay 20% in perpetuity. There's no ceiling or maximum out of pocket. You might pay $5,000 depending upon what happens if you have a big outpatient procedure. You might owe $25,000 or $30,000. With a Medicare supplement policy, it caps that exposure. So you need to look into something to cap it. So it's a Medigap plan. So there's a supplement, and the supplements are offered to you by private insurance carriers, okay? And it bridges the gap between these two separate bridges. Okay, I just wanted to show you this. I thought that this would explain it. You don't want to fall down in here, right? You don't want to owe. That's what we want to avoid. So what happens is we have Medicare supplement plans, okay? And these plans will pay for the 20% that you could potentially owe. Okay, so here it comes, Medicare supplement. And this is the last part, or the fourth part of this presentation. So some of the most popular plans out there that will bridge the gap, the Medigap policy or Medicare supplement, it's synonymous, same name, you'll hear them one or the other, is Plan G. Plan G will cover everything that Medicare does not pay for, except, and we've talked about this before earlier, the Medicare Part B deductible, which in 2023 is going to be $226. So it's set it and forget it. And Plan G premiums vary on insurance carrier. Typically, they're going to be more expensive than Medicare Advantage plans. But the difference is, and I've explained it before, the supplement plan rides along Medicare. Think about Medicare as an engine on the bus and the supplement as a chair on the bus. The supplement has to follow Medicare wherever it goes. As long as Medicare will pay, the supplement will pay. There's no pre-approvals or prior authorizations. As long as Medicare decides it's medically necessary, the supplement will pay. For an example, you're going to the doctor for the first time, okay? You see the doctor, you give them your Medicare card, you give them your Medicare supplement card, you're seen and you leave. You don't transfer any money per se. You see them and leave. The provider's office will submit the claim to Medicare. Medicare will renegotiate that claim down. This is the game that they play. If you've already satisfied your Medicare Part B deductible, then there will be nothing for you to do. It will be paid at 100%. What happens is a lot of these providers aren't necessarily contracted with the Medicare supplement plans, and that could be mind-blowing to you. What do you mean? Well, they're going to be contracted with Medicare. And what happens is when Medicare pays, they'll look to see if there's a supplement. If there's a supplement, they'll reach in and say, hey, Medicare supplement carrier, we need extra money. And through auto adjudication, the Medicare supplement plan will pay Medicare, and Medicare will pay the provider. So it's important when you see your provider for the first time, when you ask them, do you accept Medicare? And they say yes, they will automatically accept the Medicare supplement policy. And it's hard for people to grasp that because I'm not going to name them, but they're private insurance carriers that are out there. And people get that confused, thinking that the private insurance carrier that they've been on for 40 years is going to dictate their care. No, when you're on original Medicare, as long as they take Medicare, they will automatically take the supplement plan. The provider's office doesn't need to be contracted with the supplement plan as long as they accept Medicare. And when you ask them, do you accept Medicare? And they say yes, they will automatically take the supplement plan. That's a big one because people get nervous over that. Just know that you've been under the umbrella of a private insurance carrier for your whole life, but now it's time to spread your wings. You're going on to original Medicare here. So original Medicare, that's your primary, okay? That pays first. As long as Medicare says it's medically necessary, the supplement will pay, okay? So Plan G is an option, and that is the most robust option that's currently offered now. There is another plan option called Plan N, What happens with Plan N? It's a little bit less expensive. It's more for the savvy shopper, so to speak. If you go to a doctor, you'll have to pay a copay when you're seen with that doctor. And then also, you'll have to satisfy your Medicare Part B deductible, just like you do with Plan G here. But also, and the big difference between these two plans is Plan N, if you see a doctor and they don't agree to Medicare's fee schedule, it's called Medicare on assignment, they may balance bill you for whatever you've seen the doctor for. Now, I would tell you that's not many doctors. It could be 3 out of 100. If you lean into saving some additional money on Plan N, you'll just know that when you're calling a doctor, you have to say, hey, doc, do you take, well, you're not going to talk to the doctor, you're going to talk to the front desk. Hey, front desk, do you take Medicare on assignment? If you do, it's fine. No big deal. Plan G, you don't have to worry about any balance billing. It's insulated, it's covered. You don't have to worry about asking for Medicare on assignment. In our office, we've seen most have leaned towards Plan G on the private Medicare supplement plan, but it just depends. Again, it's a consultative approach, and we treat each person wildly differently. There's not necessarily a cookie cutter situation here. So that's Medicare supplement, and there are many carriers that offer Medicare supplement policies, and few are competitive. And when you're looking into a Medicare supplement policy, you want to see the strength or the power, the rating of the company. Are they A-rated? The size of their insurance pool. How big is their insurance pool and how many insureds do they have? What their previous rate increases have been over time, because you don't want to be in a Medicare supplement plan that has a double-digit rate increase year over year, and all of a sudden you're not healthy enough to switch Medicare supplement plans to another carrier to get back to your baseline premium or save some money. And people will ask, well, what do you mean? What do you mean healthy? I didn't have to answer any underwriting questions when I was initially 65 in a Medicare supplement situation. And that's what this PowerPoint presentation is for when you're turning 65. No, you don't have to go through medical underwriting, but it's important that you have to know, because it's your initial election period, or IEP. You only turn 65 once, right? So this is your initial election period. The Medicare supplement carriers have to accept you. They can't ask you any underwriting questions whatsoever. But 6 months after your 65th birthday month, they absolutely can, if you'd like to switch plans or switch insurance carriers. So it's important to lean on the insurance broker's knowledge of the market and their recommendation on the plans. And in full disclosure, insurance agencies like my agency don't get compensated in educating you on how to enroll in Medicare when you communicate to the Social Security Administration. We're not getting paid by the government. We do have to pay bills, though, and we get paid by when we enroll you in that Medicare supplement or Advantage plan, depending upon where you want to go and fit. And the rates are the rates. They're no different if you went directly to the carrier or not. Now, some of you out there might be do-it-yourselfers, and you're going to go online and enroll yourself and do all that, and that's fine. But the vast majority of you need to understand this knowledge looking forward, especially with the private insurance carriers, to stay away from carriers that artificially suppress their rates lower, trying to incentivize you to come and enroll. Then all of a sudden their insurance pool isn't running that great, and they're starting to increase the cost, and you can't necessarily afford the premium where it's going to, and you want to switch out, but yet you're not healthy enough and you could be stuck. We don't want to be in that situation, and that's why we make sure to vet out the private insurance carriers and match them up what's best for you. We give you a couple of carrier options and our opinions on what we see, and we leave it up to you. And sometimes you lean back onto us for our opinions, and we'd appreciate that, and we're happy to help. And that's what we do. And that's where the Medicare supplement policy education comes in. You're going to have to understand how this works. Now, through all of this, there's 3 pieces to the puzzle. It's your enrollment into Medicare Part A and B. It's potentially your thought process on enrolling in a Medicare Advantage plan. Maybe not. Or it's the enrollment into a Medicare supplement plan. If you're going to enroll in a Medicare supplement plan, There's a standalone drug plan, which I went over in the previous slide, that you will need to enroll in. If you're looking into a Medicare Advantage plan, they have an integrated drug plan there. You wouldn't necessarily need to enroll in Part D. You would be in a Medicare Advantage plan in Part C, which has the integrated drug plan. So that's Medicare Supplement. And that pays for the 20% that you don't want to pay for, and that's what we talked about. So essentially, that's it. That's the end of the presentation. It's as easy as this maze here. It starts off drinking as a fire hose. We're happy to help you here. We're passionate about education. We want to help you understand Medicare and the processes of Medicare on where to go. Don't fall for some phone call and some tactic. There are very, very well-funded companies out there that are going to call you and they're going to tell you anything you want to hear until you enroll. I blocked myself. Hey, so if you want to learn more about us, just look me up, Toby Stark. Just type in Toby Stark Insurance. My email address is here as well. We're happy to help you. We just love to answer questions and help you. Again, here's my contact information, Toby Stark, Stark Associates Insurance Agency. Thank you so much for hanging in here. Happy to help. Hopefully this starts a dialogue. If anything, you at least start to understand the rudimentary procedures of how you're supposed to go about Medicare, and at least you'll be more educated than when you started. And knowledge is power, and that's a victory for you. So amen for staying till the end. If you have any questions, please reach out. We're here. We're happy to help. Thanks again.